Welcome to New York Nonprofit Media. My name is Jeff Stein, and I'm here in the CEO corner with Karen Ignani, the CEO of EmblemHealth, one of the largest nonprofit insurance providers in New York City and state, a $10 billion company with 3.4 million members. A little bit of background on you. Before leading EmblemHealth, you were the president and CEO of America's Health Insurance Providers, a major voice for the industry in Washington, D.C., and in that capacity, very involved in the policy discussions around the Affordable Care Act, aka Obamacare. And you have a lot of experience in labor with AFL-CIO, the Department of Health and Human Services. You've sort of seen it from all angles, so a veritable thought leader in healthcare. So we're so excited for you to be here. And
thank you. Thank you so much for the opportunity.
Yeah, of course. So maybe we can just start by you giving a brief overview of EmblemHealth,
Sure.
What you do in the community, and also why nonprofit insurance providers are an important piece to overall healthcare as you see it.
It's a great question. You did a great job of introducing EmblemHealth in your introduction of me, but the one thing I would add that I think will be important to people watching is that we employ about 6,000 people here in the New York, Connecticut area. And I think that's important because not only do we provide health insurance to people in New York and Connecticut and who live in New Jersey, but also we provide an important source of employment for people here. So those are important middle-class jobs for folks at a time when the entire political ecosystem is thinking about how do we sustain middle-class jobs. So we have an important role in the employer community, which leads to our broader social role, and you probed it very nicely. I think when you're in the not-for-profit space, as a health insurer, you're not subject to the tyranny of quarterly earnings. We don't have shareholders. We have a community that we serve, and we take that very seriously. So we have an important role of giving back. We need to be leaders in health and wellness. We have a partnership, a very unique partnership with our Advantage Care Physicians, ACP it's called. We have 37 centers across the boroughs where we deliver primary and specialty care, and we partner with hospitals that do tertiary care. So it's another way of contributing to the community. We're also a leader in value-based purchasing. That's something that's important in the healthcare arena now. We're ditching the old fee-for-service, pay the bills, no questions asked, and going to a more prospective, value-based, paying for outcomes and getting more efficiency. So in that process, Emblem has been a leader in moving to that system. In fact, about 2/3 of our payment mechanisms are value-based. And that's an important contribution. We've been an early leader. The final thing I'd say in terms of community commitment and contribution is that quite a lot of our members are over 65. They are they're part of the Medicaid population, or they have healthcare disparities and chronic illnesses. So they've been underserved, and one of the things that we can see is once they become part of our care system, we are very strong believers and practitioners of early intervention, primary care, evaluating what people need, making sure we're knitting connecting the dots through this complicated delivery system for people to be able to navigate. So we're their boat through this complicated delivery system, and we feel very strongly about that. We're committed to that, and we've had great results in serving people with special needs and people who have had healthcare disparities and individuals who have chronic illnesses.
Great. So getting to sort of the larger policy framework, obviously the Affordable Care Act is the biggest thing to happen in the United States healthcare system in a very long time, and with its being upheld by the Supreme Court largely, it looks like it will be the law of the land unless a Republican is elected in 2016. But how would you gauge the progress of ACA right now? It seems like it's gone through its first iteration. Where do you see, how do you track its progress?
I think that's a very smart way to put it. We have as health insurance plans, been part of a process where we have helped people come into the healthcare system who before were not either able to, weren't interested in, or didn't come into the healthcare system. Mm-hmm. So on the scale of has the ACA, the Affordable Healthcare, accomplished goals, you'd have to answer yes in the access area. 10 million new people coming into the system. And we have a major role in making sure that they really have those navigation tools and we support their access to healthcare. The second issue, though, in terms of the unfinished business of the ACA, is really about costs. How do we make the system more affordable? Much of the dialogue back in 2009 and 10 was really about access. How do we bring people into the system? Now we have to keep them there. And the way you do that is to really focus on affordability. So this concept of value-based healthcare and moving to a system that really thinks about what it pays for, has partnerships between health plans and providers so that consumers benefit from that and we can reduce premium costs. That's the secret sauce that we're going to be working toward, and we've made a major leap toward actually delivering for our consumers.
Yeah, I'd love to get your thoughts on something that has been sort of in the news lately about state nonprofit co-ops. Some of them, I think, up to this point, 6 have sort of announced that they're going under because of under-enrollment, and some of the writing on this I've read has to do with the federal framework limiting the types of products that a nonprofit co-op can offer, and being compounded by the fact that really large private insurers are sort of conglomerating. Do you think that that trend will continue? Do you think that more state co-ops will sort of go by the wayside? And do you think that sort of cuts the legs out from underneath the ACA?
No, I don't. In answering you asked several questions.
Sorry.
Just know in unpacking them, the last question you asked, do I think this is going to set back the program? No. Mm-hmm. The reason I don't think so is that during the construction of the ACA, there really wasn't that much conversation around what does it take to run a health insurance plan. You can't get up in the morning and decide that you have the infrastructure to be able to offer health insurance, because that infrastructure involves being able to figure out risk, being able to do the actuarial work and have the technical support and have the experience and team able to allow you to figure out how do you price a premium, how do you think about negotiating with providers so you get affordable rates that you can pass on to the beneficiaries, how do you do the kinds of care coordination and disease management that's important for affordability, but even more important for access and quality. How do you put all that together in a way that can be sustainable? Back in the 1990s, a number of hospitals tried to be health plans, and it's very analogous to what we're seeing in the co-op space. And what they didn't realize then was that it takes a significant amount of expertise and experience to actually run a health plan enterprise. I think the co-ops had some of the same challenges that some of those hospitals back in the 90s had, because they didn't have the necessary infrastructure, they didn't have the provider relationships and the negotiating either experience or ability to work quickly with providers to make sure that they were negotiating rates that were sustainable. You put all that together, and I think that really takes the cover off the box in terms of figuring out what happened, what does it mean, and is it a sign of problems to come? It may be a sign of problems to come for more of the co-ops, right, but I don't think it's the case for the rest of the system.
So, I mean, obviously a big part of the political discussion right now is the future of all of this.
Right,
you know,
exactly.
Many Republicans say repeal Obamacare as a bit of a mantra. On the flip side of the political spectrum, you have someone like Bernie Sanders saying a single payer system should be the future. Where do you see the larger infrastructure going?
Well, I think that let's sort of take it from left to right. On the left, in terms of single payer, what I've always been excited about, the so-called single payer systems in Europe, for example, and other parts of the world, they're reaching out to our members to help them, partner with them, to do things that they can't do. Disease management, care coordination, value-based payments, et cetera. So that's a great story for our community and what we're able to contribute. So I think that we, in our country, are always going to have a uniquely American blend, which is a combo of public regulation and private sector delivery. And I think in that space, health plans we've powered the ACA. The reason that 10 million people are now covered is because of the work that the health plan community did it well, did it effectively, and did it in a very short order. That is a story that really hasn't been written. We've powered the ability of people to get into the system. We've unlocked the system for people. Now over here, how should it be sustained? What do we do? I think that politicians, wherever they are in the political spectrum, are going to evaluate do you turn back the clock for people who now are depending on a particular benefit, access to it, or do you try to continue the process of evaluating it, tweaking it, continuing to make it even more workable? And I think in the main, most politicians will end up in that mode. But obviously we're entering an election year and people have very strong opinions on either side. But I think that what has been demonstrated is there is an ability to create a uniquely American system. It's not competition or regulation, but it's a blend that actually can work. And I think does this mean that we're at the perfect state? No. We'll constantly be evaluating, we'll constantly be evolving, and I think that is positive from a consumer point of view.
Great. So something else that I've been reading a lot about in this space is discussion and debate about nonprofit hospitals being tax exempt, and just the discussion about what defines a nonprofit health entity. I know that for an insurance provider, it's a little bit of a different discussion, but how would you define nonprofit in the health delivery space?
You're going to hate my answer because when it comes to the hospital community, I have an old-fashioned view about if you're not in a particular community, you shouldn't speak for them. It's just. I know it's a frustrating thing to hear because you've asked me a provocative question, but I believe that they should speak for themselves about their community. What I can tell you about us in terms of EmblemHealth, and our board has made the decision that we are nonprofit. We're staying nonprofit. That's what we're going to do. It gives us a unique lens into the community. How can we be helpful to the community? How can we support the community? How can we partner with community-based organizations? We have a very large number of community-based organizations that depend upon us to be their insurer. That's part of our responsibility. But also in the community, serving low-income individuals, serving people with health disparities, serving individuals who heretofore have had a problem getting into the system and staying there. That's part of our mission. So we have a mission, we have a social mission. It's about responsibility, it's about commitment, and it's about making an enduring contribution to this community.
As a final question, I always like asking CEOs and presidents about just overall leadership philosophy.
Yeah, that's a great question.
You're in a
You probably should ask the employees of all those CEOs what they think about the leadership
right.
philosophy, but they're not here. So.
Well, we have a feature too where we interview who we call the frontline heroes.
Yeah, that's great.
So we like to get sort of the perspectives throughout organizations, but I would love to get your thoughts on leading such a large organization and what your main tenets of leadership are.
Well, I think I'm into the basics. I think you need to, as a leader, make sure that people understand your goals and the goals of an organization. So day one for me on September 1, so it hasn't been very long. We're speaking now, it's about roughly 8 weeks in for me. On day one, I had a town hall meeting with all of our employees, both people in the building as well as people outside and connected through the internet and so on and so forth. So they were able to connect live, just so that they could take a measure of me. It's important for people to know their leaders, know a little bit about where they come from. I come from Providence, Rhode Island. My mother and father were both union members. My mother worked at City Hall. We're close to City Hall here in Providence, Rhode Island. My dad was a firefighter. And as you said, I worked for the AFL-CIO for 10 years. So I grew up in a lower middle class family, went to college on scholarship. I feel very lucky, but it's part of a commitment to give back and also to treat people the way you want to be treated. So day one, I wanted to tell people a little bit about where I came from. I told them about my rule that I believe in treating people the way I like to be treated. I actually told people that it was just totally okay to approach me in the elevator and to give me ideas and to share what they think of our organization, what they think we can do to improve, et cetera, et cetera. So I believe in treating people the way you want to be treated. I believe in transparency, and I believe that you have to walk the walk. So if you're asking a lot from people, then you're setting a bar high. You have to be meeting and exceeding that standard, or else you won't have the confidence of the people you lead. So I'm constantly talking in the halls to people, soliciting input. I'm very, very comfortable there. I'm comfortable saying that if I've made a mistake, that I've made a mistake, because I think it's an important thing to be able to model that other people can say and own a mistake if they've made it, because that leads to a healthy workforce. I don't believe in a lot of bureaucracy. I like flatter organizations, and I really like to know what I'm talking about, so I'm a reader. And if we're looking at an endeavor, if I'm looking at a problem, I'll take the time not to, I don't want to give you the impression that I'm doing the work myself, so I don't fall into that, but making sure that I'm taking the challenge of understanding what a problem, the dimensions of a problem, so that I can come into a meeting with an informed perspective. And I love hiring people who are very, very smart and are not at all shy, coming in to basically say, you're not thinking right, here's what we need to do. I'm very comfortable in that environment. It makes me better. And so that's probably more than you wanted to know.
No, a great answer, and just wonderful to hear your thoughts about all of the policy issues, and great to hear about what EmblemHealth is doing in that space.
Yeah, thank you so much. I
yeah,
appreciate it.
Thanks so much for coming in.
Yes, it's a pleasure.